Yeah, this is Dr. Srikanth from Team MDS Conquer. Now I'm going to discuss about the diseases of maxillary sinus in this part 3. Okay, all of you know the most common thing is sinusitis, that is the inflammation of the mucous membrane of the sinus. And pansinusitis means apart from the maxillary sinus when it involves almost all other, similar to your pancytopenia, right? So that is called as pansinusitis. So coming to the etiology, the most common etiologies, I feel these are the two that most common etiologies, that is the allergy or immunity related stuff and the infection related stuff. Okay, so trauma, damage during the surgery, or sometimes abnormal anatomical abnormalities like deviated nasal septum, okay, DNS, and foreign bodies, and some genetic disorders are the very rare cases. And if you want, you can make a note about the bacteria that are responsible, and the virus that are responsible, and the fungus that are responsible for this maxillary sinusitis. But I feel questions in this area will be very, very rare. Okay, so just make a note: what are the bacteria, and what are the virus, and what are the fungus that are responsible, or that can be seen as a microflora responsible for sinusitis. Next comes is the classification. Acute sinusitis will be less than 4 weeks. Subacute will be in the range of 4 to 12, whereas the chronic, most of your questions move around chronic, that will be more than 12 weeks. Okay, so coming to the acute things, and most of the things are well known by you. There will be headache, heaviness because accumulation of lots of mucus. And whenever there is a change in the position, as already discussed, this is in an air space. Whenever there is a change in the postural position, the mucus will try to move from here to there and cause some sort of compression, and the facial pain will increases. Fever and chills are common. Nasal blockage or obstruction leading to the accumulation. Difficulty in breathing, cough. The two that is associated with that, or maybe in that zone, may have some pain. Lymphadenopathy is already discussed because these are going to drain to the lymph nodes nearby. And coming to the chronic, most of the symptoms, everything will be like aggravated or get accumulated. So most of your questions move around chronic. The pain will be dull. Pain on percussion of the involved teeth, it's a good seen. So please do add this. Fever is common. Lymphadenopathy is common. Heaviness of head is common. Okay, acute cases, you will not have pus, you will have inflammation, whereas in the chronic cases, you will have pus, or the pleurent discharge. Next goes is the fistula, is again the acute case. Whenever you have pus, you will feel a halitosis or discomfort or abnormal taste sensation in your oral cavity and ear. So all these are the very peculiar things which can be seen only in the chronic cases. So there are few cases where they have given a case-based question in your Comet K, that is about this chronic maxillary sinusitis, and of course in the AIMS they have given a radiograph-based question several times. So it's mandatory that you have to learn the difference between the acute and chronic, how to differentiate, because definitely acute will be an option in your question for sure. Next comes the tests that are used, or the diagnostic modalities for this particular situation. It is regularly performed in a dark room, that is a transamination test, where a safety bulb is inserted into your oral cavity, okay, with lips closed, and good elimination indicates the presence of air in the sinus, whereas the failure or the bad elimination, this is a good elimination. Bad elimination indicates there is some sort of pus or fluid or foreign body which is obstructing the light to hit, right? So this is a transamination test which is used for diagnosis of sinusitis. So apart from that, regularly is a radiographic sign you can see here, so by which you can diagnose chronic sinusitis, because acute sinusitis cannot be differentiated on the radiograph, whereas chronic sinusitis can be differentiated by having, like, if you compare one side to other side, this is a unilateral thing where you will have a clouding with air filled spaces and mucus in your sinus wall, right?